The Seena Magowitz Foundation is committed to the cause of funding pancreatic cancer research and has been especially focused on funding clinical trials for potential new treatments for the disease. One of those trials is being conducted by Dr. Doug Evans, professor and chair of the Department of Surgery at the Medical College of Wisconsin. Dr. Evans is on the front lines of research on this disease and is here to tell us more about his critical work. Also with us today is Jack Chase, one of Dr. Evans' patients. Thank you both for being here.
Well, thanks, Miranda, and thanks, Jack, so much for joining us. It's great to be here, and we owe so much to the Seena Magowitz Foundation. It's just a wonderful group of incredibly committed individuals who support our work. So important.
We appreciate it. And now, Dr. Evans, we know it was important to you that Jack's perspective be included in this interview. Can you tell us more about that?
Well, as I've mentioned many times, the treatment for pancreatic cancer can be easily thought of as a marathon. It's emotionally, physically taxing. It's very difficult for patients and their families. One of the reasons why we don't have more patients like Jack is simply that people are emotionally exhausted after their treatment, and then trying to become advocates for this disease is oftentimes very difficult. And for people right now who are receiving chemotherapy, radiation, they're either getting ready for a big operation or trying to recover from a big operation. Hearing from people like Jack is just so inspirational, so important. It brings energy and enthusiasm to them. Jack and I share a tremendous passion for baseball. We're huge Brewers fans. And for those of you who have any doubt the Brewers will be back next year, not to worry. And I know that we also share a passion for improving the outcome for people with pancreas cancer. And Jack, thanks so much for taking time to join us today.
Jack, would you mind sharing with us your journey with pancreatic cancer and then your treatment with Dr. Evans?
Yes, my journey started back in 2013. We started out with, we did chemo once a week, radiation 5 times a week for 4 months. Then I had a month off to help recover, did our Whipple, and then I had another month off and went back on chemo for 4 more months, and ended in December of 2013. And very exhausting, but worth every penny and every minute of it, because I've got to see many things. I got to see a grandson born. My granddaughter just turned 10, and I enjoy every day of it.
Wow, so that was 7 years ago. How are you feeling now?
I feel fantastic. Like I say, every day is a journey. It's beautiful outside today. It's a great day here, and I'm looking forward to going outside and doing some work on the farm.
That's so awesome. And what would you say, I guess, to encourage other patients that are in your similar situation? I mean, you mentioned that doctors told you you had less than a year.
Yes, yes, and it's just amazing that how it can turn around, and how by finding Dr. Evans and the right treatment, it's everything is possible. Yeah, and my treatment alone was over 8 months, and amazing. Like Shannon from your office, she was fantastic. She babysat me. Yeah, and Faye, my fiance at the time, she's now my wife. She supported me every minute of the day. I mean, there's times that it was very, very dark. It was very hard, you know. I went to work all through it. There was times she had to come pick me up because I couldn't have the energy to drive home. The family support and friends too were just amazing. It's the people around you make you, and I was surrounded by a lot of very positive people.
Oh, fantastic! Good for you. Well, we're so thrilled you're doing so well. It's absolutely wonderful, and our quest and the support from the Seena Magowitz Foundation is going to make sure that we have more Jack Chases in the future. Absolutely.
Yes, and thank you so much for being here with us today, Jack, and sharing your story. We wish you all the best on your journey.
You're welcome. Very nice meeting you.
Dr. Evans, to start, how did you get involved with the fight against pancreatic cancer?
Well, I became interested in pancreas surgery probably as a medical student. I went to Boston University School of Medicine, and as part of my financial aid package, I needed to direct undergraduate dormitories on the Charles River campus. And as you would imagine, and this is back in the 1980s, it wasn't very easy to study in undergraduate dormitories. So fortunately, the Leahy Clinic was across the street from me, and I had a little part-time job also at the Leahy Clinic. And I studied in the Leahy Clinic library, and many of the beginnings of pancreas surgery in the United States started at the Leahy Clinic with a couple of very well-known surgeons. And then I did my residency at Dartmouth and was fortunate to work with a very skilled surgeon named Dick Carl, who had an interest in pancreas cancer. And I then went to the University of Texas MD Anderson Cancer Center for my fellowship. And really my main interest at that time was pancreatic cancer. And I was fortunate that Charles Balch, who was the chair of surgery at the time, offered me a job to stay, and ended up staying in Houston for 19 to 20 years and really focused on pancreatic cancer. And it was a disease that really had very few options in the mid 1980s, and we've made just incredible strides. One of the things that we were interested in from the beginning was really how best to combine chemotherapy, radiation therapy, and surgery. And I think the patients in the audience and those patients or family members that are listening to us will appreciate that pancreatic cancer is unique and that it really is a multi-system disease. There are challenges oftentimes with the bile duct. Patients need a stent or some way to decompress their bile duct. Really, our technology in stent management really didn't develop until the 1990s. I mean, it really is not that old. We also have to pay close attention to nutrition, to blood sugar management. Oftentimes diabetes is an accompanying factor in patients who are diagnosed with pancreatic cancer. And it's crystal clear that a combination of chemotherapy, radiation therapy, and surgery is superior to any one modality alone. And the trick then is how are you able to take a patient, most of whom are in their 60s or 70s, occasionally 40s and 50s, but they're not in their 20s. So how can you take a patient who may have other medical issues, be it a little bit of heart disease or some other medical issue that is a little bit of a challenge, and get them through, as Jack mentioned, 6 to 7 months of treatment to include, in the end, what will be a fairly large operation. So it's a disease that really I have devoted my life to. I know that there are many other physicians and scientists who have done the same, but the rewards could not be greater. The patients are so grateful, and their families are so wonderful.
And we're so thankful that you have devoted your life to this research. In fact, will you tell us about the clinical trial that you're working on now, that the Seena Magowitz Foundation is actually a part of funding?
Sure, that would be great. And my huge thank you to the Seena Magowitz Foundation, because such high-risk proposals would not be possible without foundation funding like this. So the technology we're using is quite sophisticated and state-of-the-art, but the fundamental theory and the principle is very straightforward. So right now, with the best possible chemotherapy that's available in the United States, approximately a third to a half of patients will benefit. Certainly some of the unique combinations that Dan von Hoff and Erkut Berzanzi are putting together, that number is getting even higher. But in general, outside of really unique clinical trials that we're doing, for the many patients, for the thousands of patients in the United States, and certainly for the millions of patients worldwide, the likelihood that they will benefit from the chemotherapy they receive is probably a third to a half. And that means that a minimum of a half of the patients, 50% of the patients, have no chance of benefiting from the chemotherapy that they receive. What this trial aims to do is, through a tiny needle biopsy of the pancreas, do a very sophisticated genetic profiling using RNA technology that was developed at the University of North Carolina. We're doing this in collaboration with Dr. Jen Ye's laboratory at the University of North Carolina and determine the genetic profile, and the terms that we use are classical versus basal, the genetic profile of the tumor as a guide to the initial chemotherapy. We know that whether a patient has a classical tumor, as defined by their expression of a series of genes, or whether they have a basal-like tumor, will determine their response rate to the most commonly used chemotherapy, which is abbreviated as FOLFIRINOX. This technology is quite unique. It's not something that is commercially available, and no one prior to us has been able to do this on a needle biopsy, which provides a very small sample size. The technology now has been worked out. So what we're trying to develop, you heard recently from Jack Chase, one of our patients, who now is a 7-year survivor of pancreas cancer. We typically equate that with a cure. Pancreas cancer recurring at or after 7 years from treatment is essentially unheard of. What we want to do is create more Jack Chases. So Jack was treated with a similar paradigm of chemotherapy, radiation, and surgery. His was a bit different because it was quite a while ago. And we obviously were very lucky that we picked the right treatment for the vulnerabilities of his tumor in a patient who had the optimal host response system. For every Jack Chase back 7 years ago, we unfortunately had 2 patients who were not that lucky and their cancer recurred. With this trial supported by the Seena Magowitz Foundation, we want those 2 patients to move into the Jack Chase category and have all of our patients be 7-year survivors. Even more importantly than this relatively small clinical trial, this could easily change how pancreas cancer is treated in the entire world, because patients could virtually every patient receives a needle biopsy to confirm the diagnosis before they receive treatment. So easily a year, 2 years from now, every patient, especially in the United States, could receive this needle biopsy, undergo this genetic profiling, and then receive the right chemotherapy to optimize their chance of response. So we're so excited with this.
Yeah, it's so exciting. I mean, you talked about what you're hoping the results are. What's the best case scenario that comes from this trial, in your opinion?
Well, I think the best case scenario would be the way we're treating patients is they receive a minimum of 2 and certainly, hopefully, at least 4 months of chemotherapy, to which we would like to see a response. And we measure that response 3 ways. Number 1, how the patient is doing. Those patients who respond well to chemotherapy typically feel better. Even though they have some side effects from the chemotherapy, their week off from chemotherapy, they feel better. If they had pain due to the tumor at diagnosis, that pain is better. They begin to maybe eat a little better, they stay hydrated, et cetera. So we assess how they're clinically doing. We also look at their CT scan. We repeat their CT scan every 2 months. We would like the tumor to reduce slightly in size, even though it may not change with respect to its relationship to adjacent blood vessels and other aspects of human anatomy. We would like it to maybe get a little smaller. And then third, we look at biomarkers in the blood. In this case, we're looking at a variety of sophisticated biomarkers in the blood, but I think many of our audience will be familiar with so-called Carbohydrate Antigen 19-9 or carcinoembryonic antigen, CEA. So we measure CA19-9 and CEA levels, and we would like that CA19-9 level to decline. About 75% of patients produce CA19-9, approximately 20 to 25% do not, based on their Lewis blood group antigen. But if they produce 19-9, we would like that 19-9 to go down. And our hope is that would occur in virtually all of our patients. Clearly that may not be the case, but we would like to have the most effective therapy delivered at the beginning to every patient with pancreas cancer. Right now, when a patient receives ineffective treatment, that isn't appreciated for 2 or 3 months. I think everyone would realize that after one dose of chemotherapy, it's probably impossible to know whether it's the right chemotherapy. But certainly after about 6 to 8 weeks of chemotherapy, we get a feeling for whether that chemotherapy is working or not. And in this particular trial, our goal is that we will know after the first 4 doses of chemotherapy, so after approximately 7 weeks of treatment.
Dr. Evans, we talked about the treatment of pancreatic cancer. I mean, you've been with it really since the beginning. How would you say it's changed over time?
Well, I think one of the big changes is there now is optimism. And I think that's so important. I've mentioned before that the treatment is a marathon. And I think for many patients, they remember that everyone has a varied team of support. We would love to have every patient come to us with a team of support that would ensure that they had someone to drive them back and forth to the medical center, that they had access to proper nutrition, to hydration, that they had someone kind of boosting them up when they were feeling emotionally down. That is not always the case. And I think 10, 15 years ago, it was even harder because there wasn't that optimism that exists with the disease today. And to be honest, a lot of that optimism comes from places like the Seena Magowitz Foundation and other foundations that just provide that support. I mean, one thing that we're missing in the pancreas cancer world is we're missing advocates like the Seena Magowitz Foundation. I think because pancreas cancer is exhausting. And, you know, when you compare the treatment for pancreas cancer, you would compare it perhaps to bone marrow transplant and solid organ transplant. Just think about this for a minute. Compare the advocacy that you hear about on radio, TV, when you watch a football game or a Major League Baseball game. You hear about breast cancer, you hear about prostate cancer. How often do you hear about the people who undergo a bone marrow transplant or the people who undergo a heart or a liver transplant? They're grouped with pancreas cancer. You hardly ever hear about the plight and the challenge and even the successes of those patients. And I would argue it's because the treatment is so rigorous and to some degree exhausting. And even when we have our greatest successes, many people are simply too tired to then pick up the flag and keep the charge going and do what they can. And I think that's what's so wonderful about Roger, about his family, about the Seena Magowitz Foundation. I mean, it's just fantastic. And I think with more energy, with more enthusiasm, you will see purple ribbons on the helmets of Major League Baseball players. You're going to see them on the cleats of the National Football League. I mean, we're going to get to the point where breast cancer advocacy and prostate cancer advocacy and others are right now. And I think hearing about pancreas cancer, November is Pancreas Cancer Awareness Month. We have a couple radio shows right in Milwaukee, sponsored by the Department of Surgery on WISN, which is part of iHeartMedia. And I think you know, we bring this forward in our radio shows virtually all the time. But for patients, hearing about the energy, the enthusiasm, the fact that our treatments are orders of magnitude better than they were 5 years ago and 10 years ago, that alone is translated into hope in the minds and the hearts of patients and their families. And you know, that hope for a better outcome, even if that hope is not necessarily linked with a cure, but that hope for a better outcome is just so important.
So, Dr. Evans, you talked about the Seena Magowitz Foundation. What would you say to encourage people to support and really get behind organizations like the Seena Magowitz and just support the work that they're doing?
Absolutely. Well, I can tell you our commitment to the Seena Magowitz Foundation is that we will provide innovative clinical trials that people can wrap their arms around. And I think if those of us who are involved in cancer research, If we provided a more tangible and understandable explanation of what we were trying to do, I think people would donate to us. They would support our cause. I think it's when you compare cancer research and wonderful groups like the Seena Magowitz Foundation, you compare that to the other great things that people support in our communities, which are wonderful. The symphony, the art museum, the boys clubs, the girls clubs. I think the reason that they're so effective is that there's nothing abstract, that people in the community can say, I know I'm going to make a donation to the boys clubs of Milwaukee because, you know, they're in our underserved populations and they're supporting that inner city baseball league. I mean, there's something that is tangible there. What we're trying to do is provide that tangible, easily understood concept to cancer research and also to the Seena Magowitz Foundation. We're going to change how pancreas cancer is treated in the entire world with this clinical trial. I mean, I have absolutely no doubt that that will be the end result of this, and that the technology we're using for biopsy of pancreas cancer, this technology will be applied to every single patient who is newly diagnosed in the United States. And instead of taking a chance, in other words, when their doctor applies their first treatment to them, and there is about a 1 out of 3, maybe 1 out of 2 chance that that treatment will be the right treatment. When we get through with this clinical trial and this technology is adapted worldwide, there'll be a 1 out of 8. I mean, there'll be a 8 out of 10, 9 out of 10 chance that that treatment will be the right treatment at the very beginning. And certainly with pancreas cancer, I think no patient has 2 months to waste. Probably 1 or 2 weeks doesn't make any difference, but 2 months is a long time with pancreas cancer. So I would encourage everyone who has been inspired by Roger and his family, by the Seena Magowitz Foundation, to think about this. I mean, we're doing things that hopefully everyone can wrap their arms around and completely understand. You know, we're not trying to make, as Dr. Dan von Hoff often says, we're not trying to make a little difference. We're trying to make a big difference. And the trials that are supported and the cancer research efforts that are supported by Seena Magowitz, they have high aspirations. They're designed to really change the landscape of how this disease is treated.
Dr. Evans, thank you so much for taking the time to speak with us today. We appreciate everything you're doing, and we're really looking forward to seeing the efforts of this trial unfold.
Well, my pleasure, and thank you again to Roger, the Magowitz family, the Seena Magowitz Foundation, and everyone who has supported this tremendous cause. We're so excited and also so grateful.